start now.
Hi friends,
Hello, sir.
I am Dr. Sanjay Gogia, consultant diabetologist practicing at Delhi. Friends, today we will discuss about diabetes and kidney. Kidney is an important complications which may develop in diabetic patients over the period of time. We will try to understand what it is, why it is important, what are the preventive steps we can take to prevent diabetic related kidney problems. Kidney, as we all know, is an important organ in the body which filters many harmful things from the body and tries to retain some of the useful substances in the body. This process is very selective, which occurs at the level of something called glomerulus, which is basically the filtering mechanism of the kidney. In a diabetic patient, because of very complex pathophysiological changes, generation of some of the harmful products, large amounts of cholesterol related problems over the period of time, circulation of the kidney is affected. There is lot of damage which begins in the glomerulus. It affects the filtering mechanism of the kidney. The net is the kidney loses protein, which is one of the most important useful substance for anybody, and in turn it again tries to retain some of the harmful substances which are normally filtered by the kidney. This complex scenario wherein protein is losing and the body is retaining lot of harmful products leads to complex problem which is called as diabetic related kidney disease. Once protein is lost, once harmful substances are retained inside the body, the net result is lot of other harmful effects which occurs at the level of whether metabolism, whether tissue related, oxygenation, blood pressure dysregulation, cholesterol dysregulations, and leads to lots of day-to-day complications. That was about what is exactly kidney problem in a diabetic patient. What are the steps wherein we can check the thing early and modify our disease protocol? The first and foremost is urine microalbumin. This is estimation of some of the minute quantities of proteins in urine which should not be there normally. But once patient is developing kidney problems, and diabetic patient is developing kidney problem, these proteins will be in detectable range. This should be a warning sign for all of us, which should lower our threshold for disease modification, alteration of the pathophysiology as soon as possible. This should be part of our routine investigation, especially for all the diabetic patients, at least once in a year, and if required, maybe more than once in a year, because this is the only clue wherein we can intervene and modify the progression of the disease. There are other blood related parameters, urea, creatinine, sodium, potassium, some of the hormones which we can estimate as the requirement may be, which also gives us some fair idea about deterioration of kidney function. Ultrasound and renal Doppler are other modalities. What next? Once we have diagnosed kidney related problems diabetic patient is developing, we should be modifying the treatment so as to alter the disease progression, rather reverse the things as soon as possible, which definitely includes lots of dietary modification. Do take consultation of dietitian, regular exercise. Nobody can say that exercise has got no importance. Exercise definitely has got its importance to improve the overall pathophysiology. Next comes modification of treatment for sugar control. Glycemic variability is the new concept which is coming, wherein variability of glucose, day-to-day fluctuations of glucose should be definitely taken into consideration so as to minimize the chances of further complications. If you are hypertensive, do take care of your BP. Cholesterol, don't never ignore the cholesterol. Smoking, big no. Alcohol in moderation. Overall, things can, if taken care appropriately, can always be modified. Thank you.